Okay, so I've got someone with us today who's probably familiar to everyone by now. It's Michelle. Michele Worden was advanced neonatal nurse practitioner at the Countess Hospital. I've interviewed her 3 times previously. If you haven't seen those interviews, please do check them out. So I'm not going to do a massive introduction. I'm just going to say hello to Michelle.
Hi Chris, how are you?
I'm very well, thank you. I got a bit soaked the last few days. It's been muddy. I've had to put my dog in the kitchen today. She's absolutely filthy, but otherwise I'm very well. How are you?
Yeah, I'm good. Same thing, out walking the dog in the mud is not my idea of fun. I'd rather have 80 degrees and blue skies and sunshine.
Yeah, yeah,
But
definitely. It's going to be a while till we see that, I think. Um, so today I'm going to ask Michelle. We started to do the viewers' questions the last time she was on, but I have many left for her. And the first one I'm going to ask Michelle is because someone asked me this recently, is do you know when Dr. Stephen Brearey joined the Cancer Chester Hospital?
I think it was sometime between 2008 and 2010. And when he came, John Gibbs was the clinical lead for the neonatal unit. But once Steve Brearey started, Steve Brearey took over being the clinical lead for the neonatal unit.
So when around this time, around this period, we know that the unit became a level 2 unit. Was it always that way, or was it upgraded, or
No, no. So going back historically, when I went to work on the unit in '88, we took every sort of baby with the exception of surgery, because all surgical babies were taken to what was known as Oxford Street Maternity Hospital. It's now Liverpool Women's Hospital. In the early 2000s, about 2003, the Department of Health wrote a white paper looking at trying to streamline neonatal services around the country. And that's how the regional neonatal networks were set up, of which we came under Mersey. And it was deemed that the two level 3 units would be Arrow Park Hospital and Liverpool Women's. So they changed the criteria then of the babies that we could keep. And we went to a level 2 unit. And that was one of the excuses that management used for dispensing with the senior nursing staff because they said, oh, you wouldn't have as many sick babies. But sick babies can occur even at term. So that was a bit ridiculous, really. But it was all about cost cutting, it was about saving money. So the unit was downgraded. The white paper was published in 2003. The unit went to a level 2 in 2005, 2006. And that's when the cull started. And I was made redundant in 2007. So between 2006 and 2010, by various methods, 8 senior nurses were dispensed with. And then, of course, in 2010, they employed 8 nursery nurses. So, nursery nurses have a role to play. I'm not anti nursery nurses, but they should be there to enhance the role of a registered nurse, not to replace a registered nurse. And then, of course, in 2012, they employed 2 brand new qualified nurses, one of whom was Lucy Letby, straight out of university.
okay? So that gives us some background. So I guess my follow-up question would be, Dr. Brearey has obviously presided. He's been present on the unit for a period of time when I think we all agree it was declining, certainly in terms of staffing. So, I mean, shouldn't he have picked up on that?
Well, the problem with all of that is that I think they coasted for a long time. The statistics, the number of babies they were having, and the number of deaths they were having, all remained pretty constant.
Hmm.
And it's like anything that goes wrong, be it an aircraft crash, a train crash, an accident in a hospital, it's never one thing.
Hmm.
So they'd got rid of the senior nurses, they'd downgraded the unit, which also in tandem actually de-skills a lot of staff because you're no longer looking after the sickest babies. The consultants were not there. They had their own interests. Steve Brearey is not a neonatologist. He's a general paediatrician with an interest in cardiology. But when he came, John Gibbs, who had previously been the clinical lead, moved on within the department, and Steve Brearey took over the clinical lead of the neonatal unit. And things were relatively stable until you get to 2014, and that's when you really can see things are starting to go wrong with baby Noah Robinson. Because, as the coroner said in that case, what's the point of having really expensive, highly technical equipment if you don't believe the readings? And that's exactly what they did with poor baby Noah Robinson. They didn't believe the readings on the monitors, so they didn't use their clinical skills to think, actually, there's something major going wrong here. They spent 40 minutes changing monitors, changing probes, without actually looking at this poor baby who was becoming more and more anoxic and ended up dying. So that was the start. And then when you look at what Alison Timmy's consultant pediatrician wrote, by December 2015, they were funded for 15 cots. We know in December 2015, at times they had 21 babies. And she writes in her email, we're running out of basic equipment. We don't even have incubators, which is clearly indicative of how many babies and how busy they were. And she's put in that email, something's going to happen. It's either going to result in the loss of children's lives or the physical and mental well-being of the staff. The staff cannot give the care they want to give. And then, of course, we move on to January 2016, where the manager, Ariane Powell, we now know because of Thirlwall, wrote a business plan asking for 10 registered nurses. Now, if you're 10 registered nurses down, that's a clear indication of how short-staffed you are. So it became the perfect storm. They had more babies than they were funded with. They had consultants who were not on the unit. They were doing 2 ward rounds a week. They had not enough staff. The staff they had were probably not of the right caliber and experience. They were running out of basic equipment. It's just the perfect storm, the absolute perfect storm. And we now know also that when I was there, the maternity and children's was all under one directive. I believe in about 2012, they had split the directorates. So neonatal services, for some reason, came under a different directive, which reduced the communication between the maternity side and the neonatal side. The maternity side, and God knows why they did this, they put under planned care, but maternity services on a labour ward is not always planned care because you never know who's going to walk in the door. You never know if you're going to have to do an emergency section or an emergency ventouse or whatever. So I don't know why they put maternity under planned care and kept neonatal services under a completely different directive. But I think that had probably a lot of repercussions where the communication was breaking down further. And certainly we know from Thirlwall, when you look at statements from the neonatal nurses, I think Caroline Oakley and Caroline Bennion both wrote, oh, we'd go through to labour ward and say, we can't take any more babies, but they weren't shipping these mothers out. They were delivering them. And then we had more babies, and then we're reliant on the transport team coming out. And the transport teams had their own problems because they'd amalgamated with Manchester. So you're talking about a huge, huge geographical area covering North Wales, Merseyside, Cheshire, Greater Manchester, Lancashire, and Cumbria. And this isn't like London where you've got a hospital every 3 miles. Some of these hospitals are 20, 30 miles in between. So it's just the perfect storm.
Yeah, yeah, absolutely. I mean, in the case of Child K, there's the that infant died at the hospital. I looked at the distance specifically just so that I could outline how absurd it is that they were going to charge Lucy with murder for an infant that died 3 days after she'd had any contact with it,
Yeah.
approximately 30 miles away.
Yeah.
It's just a joke. But yeah, that's
And
something.
he goes back to baby Kay. That mother was on labour ward for a number of days, and they talked about moving her. But because of the lack of intensive care beds around the country, it's not just within Mersey region, the nearest level 3 bed was Preston, which is more likely 60 miles away. So they deemed it too dangerous to move that mother 60 miles in the back of an ambulance. And we don't have a good helicopter system in this country. Um, you've got helicopters all over London, but where we actually need them, where we've got these huge geographical areas, we don't have them.
Mm,
It's just all wrong.
yeah, yeah,
So you're expected to put mothers and babies in the back of ambulances, not always on very good roads. Certainly, if you're up in Cumbria and Lancashire, and they're not always main motorways, and these poor people are bouncing around in the back of an ambulance. They should be airlifted, but we don't have those resources.
yeah, yeah, absolutely. So that's some good background to the hospital and Stephen Brearey coming onto the unit. So I hope that answers your question. So second question is, we wanted to talk about Lucy's grief. So we know a fair bit about this already, but do you know anything more, or do you have any comment to make regarding her grievance procedure?
Well, Lucy took out the grievance procedure because she'd been removed from the unit, and they were not honest with her about why she had been removed. Again, if you go back to Thirlwall, Karen Rees talks about how distressing she found it, that she knew more about what was going on than the person who was being put in the frame. So Lucy rightly, I think, took out a grievance. However, and it was upheld. Dr. Christopher Green, who's the chief pharmacist, investigated. And he actually said at one point that he thought the consultant paediatricians were lying. He upheld Lucy's grievance. Management were not being honest with her. They weren't being honest with any of the nurses, but they certainly weren't being honest with Lucy, who they absolutely should have been honest with. Um, but knowing what I know now, and the fact that when the grievance was upheld, and Tony Chambers and Ian Harvey said to the consultants, "You're going to have to apologise to this nurse," I can imagine they were incensed. And is that another reason why they kept pushing for the police to be called in? I mean, there's so many things that just do not make sense. But apologising to Lucy, I can imagine really put those consultants into overdrive. Um, and it wasn't just the consultant paediatricians who had to apologise, it was also Jim McCormack, who was the consultant obstetrician and the head of the fetal medicine unit. I've seen the apology letters, and quite frankly, they're not apologies at all. They're what I call non-apologies of. I mean, Jim McCormack says, "Oh, I'm really sorry that I said inappropriate things, but I didn't name you, and nobody knows it was you." Well, of course they knew it was Lucy because she'd been removed from the unit and she'd taken out a grievance. I mean, it's just nonsense. I would have thought that they would have at least have had the guts to go, "I'm really sorry. We understand the distress and we shouldn't have done this." But they didn't. They gave non-apologies. And as I say, I can imagine they were really, really cross. And following the grievance, I know that Ravi and Steve Brearey were asked to go to mediation with Lucy, and Steve Brearey point blank refused. Ravi, in fairness, did go to mediation, but on I think it's the ITV interview he gave, he says he was really crossed and he found it really bizarre that he had to go to this mediation with her because he was firmly of the opinion that she'd done something. I don't know if Steve Brearey was still of that opinion because, again, out of Thirlwall, things have come out about him saying, well, if she doesn't come back to the unit, that'll be the end of it. But if you seriously think you've got a serial killer, why are you going to allow her to go and work somewhere else? Do you not have your patient's best interests at heart? And if you think somebody's murdering babies or children, why would you let them just walk away and go to another hospital? It doesn't make sense. None of it makes sense.
It all comes back to this ridiculous claim that, oh, we would have phoned the police, but we didn't have any training as to as to how to do it, you know.
Rubbish.
I mean, come on, like it's just embarrassing. Like you're a grown man. If
But
you,
it's interesting because if you fast forward to 2020, and Ravi was apparently down on the Meadows, which is a vast area in Chester where he likes to go jogging. And there's a rowing club down there that belongs to a local school. And some kids were shouting racial abuse at him. Now, I'm not condoning that at all. They absolutely should not have been doing that. But Ravi phone the police. So he can phone the police when somebody's shouting racial abuse at him, but he can't get in his car and drive to the police station when he actually thinks somebody's murdering babies. Come
well,
on.
I mean, I don't. I mean, I think it's very clear that they basically just wanted the police to be involved without them having to take any risks or without having to show any. It's just a lack of courage, really. They know whistleblowers. They know they would have been putting their necks on the line, and also I suppose they know that stuff could have come up about them, which of course it has. So I think it was just a lack of courage, basically. I think it's very clear why they didn't. Nothing to do with not having training. That's just complete rubbish. Um,
I also think now that did they go to the police because they were really, really cross that Lucy was whistleblowing? She'd had her grievance upheld. They'd had to apologize to her, which, as I say, I can imagine absolutely incensed them. And they thought, right, we're now really going to push the police. But we know there's no evidence. But she won't be coming back to the unit, which is what I think Steve Brearey wanted to achieve from the very beginning. But then what they hadn't factored in was dear old Dowie Evans rocking up with his theories, because I know lots of neonatologists and I know lots of neonatal nurses, and I don't know one that believes in Dowie's theories.
hmm.
Now, Steve Brearey and Ravi Jayram are not stupid people. How on earth could they have sat there and thought the police have got Dr. Dowie Evans, he's coming out with all this stuff, and believe it? I don't believe they did believe it. But by that time, they were on a runaway train
Hmm.
because they'd called the police in. It hadn't worked out the way they'd wanted of Lucy getting slapped hands and moving on to another hospital. They were in too deep, so they couldn't call it out.
I'm just looking on the complete trial. So um, they weren't in court for child G. I'm just going to see which case they were. No, yeah, Dr. Stephen Brewer was in case for child G. He was in court for child G. So he gave evidence on the same day as Dr. Evans for child G. So this is the milk case, isn't it? So he can't possibly believe, surely, as you say, that the milk explanation is legitimate, surely.
No, but they knew before. So back in when Lucy was charged, I wrote to Ben Myers, and there was things by that time out in the press. And I mean, we could have a conversation about. I really think the press were despicable in some of the way they were portraying Lucy before she'd even been to court. Whatever happened to you are innocent until proved guilty? But because of the way the media was portraying Lucy, some of Dowie's causes of death were in the public arena. And one of them was this injecting air down the nasogastric tube. So when I emailed Ben Myers, which I think was in 2022, no, 2021, anyway, when Lucy was charged,
Yeah.
I wrote a long email to Ben Myers about the whoosh test. Now, those consultants also know about the whoosh test.
Hmm.
Why weren't they calling it out? And also, in March 2020, I went to a friend's funeral and Jim McCormack was there. And Jim McCormack and I had a conversation, and I said, I don't believe this nurse has done anything. At the time, I didn't know Jim's involvement of pointing the finger at Lucy or standing up at the meeting saying to Ariane, you're harbouring a murderer. But Jim's a very nice, charismatic Irishman. I've known Jim for 30 odd years, worked with him, and we had the conversation. And I walked away because at some point during our conversation, he sort of leant into me in a very conspiratorial way and went, but I've heard, Michelle, there's insulin. And now that was the first time I heard about insulin. That was not in, well, not that I'd read in the public arena at that point. And I was like, really? And that did make me think, oh, maybe I've got this wrong. Maybe she has done something. But then when the insulin stuff came out, again, I was asking my friends, well, was the insulin ampules missing? We only ever had two ampules of insulin, a fast-acting one and a slow-acting one. I now know from the court case that over the indictment period, which was 10 months, there was actually only 6 ampules on the unit. But that doesn't mean there were 6 ampules at the same moment in time. They would have been replaced, gone out of date, whatever. And certainly, as I think I said in one of my previous podcasts with you, if you talk to Helen Shannon, who's one of the expert insulin experts, for the reading that they got on the immunoassay test of 4,000 odd units, you would have had to use about 10 ampules in a bag of saline. So where did she stockpile all this insulin from? The insulin wasn't missing. There wasn't massive doses floating around, ampules. It's just all nonsense.
Yeah, absolutely. Hard to disagree. Um, so let's move on to the next question. I don't know if you know this, but do you know if the hospital has increased the number of ward rounds as they were so strongly criticised for that?
Yeah, they did that immediately after the Royal College report when Lucy had been removed. They employed new consultants. Amazingly, they employed some ANMPs, which just makes me laugh.
I remember you saying about that.
And they,
I remember you mentioned that to me in our very first conversation when I very first met you. That they got rid of you and then they decided, oh, we need an advanced neonatal nurse practitioner. But
yeah,
of course, they had one.
well, they had two actually. There was two of us,
Okay. Yeah,
and they got rid of the two of us. And then after the Royal College report, they employed some new ANMPs and they increased the staffing and they employed some more consultants. And yeah, happy days. Everything went back to the way it was before 2007.
yeah. So that clears that one up.
But also, they didn't have the workload, you've got to remember as well. So after they'd taken Lucy off, they downgraded the unit to a level 1. So not only did they have less sick babies,
Hmm.
but they increased the staffing, they increased the medical staff, and they had ANMPs. So
Yeah, it makes a big difference. I think something that people miss as well sometimes is that as much as we highlight the problems of this unit, and that's legitimate, anyone can have a bad run. Like you could have a bad run at any hospital. It can just happen. It's part like a million planes take off
yeah,
and one of them crashes at some point. And often there are reasons identified for why that happened. But sometimes it's just unfortunate, that you just occasionally have these things happen. So a spike by its very nature, it goes up, then it goes down. If
yeah,
if it'd gone up and then stayed like that, that would have been extraordinary. That's just not going to happen.
no,
That's the nature of a spike. I think that's missed sometimes by people. Like, oh, the number of deaths went down. but they probably would have gone down whatever happened to some extent because it's just a bad run, and that can happen. It's
Yeah.
just the nature of a random system, you know.
And also, you've got to look at um, when Steve Brearey still first started pointing the finger at Lucy, there was three deaths all in June 2015, which is very unusual, you know, to have three deaths so close together. But the spike that became was not that high by that time. They'd had one death in March, which was due to a congenital abnormality, so was fully explained. So having three in June, if they'd have never had any more deaths for the rest of that year, that wouldn't have been abnormally high.
No.
It was just a coincidence that all three were in June. So why was Steve Brearey suddenly so convinced? Was he covering up his own tracks? I mean, certainly there's lots of questions about potential litigation with those first babies.
Mm.
So we know that the twins, A and B, that mum instructed lawyers. She contacted the coroner. We know that baby D's mum definitely had instructed lawyers, and there was clear medical negligence there because that mother had had ruptured membranes for 60 hours and not received any antenatal antibiotics. Going back to the twins had had steroids. The mother had had steroids at 23 weeks, but they weren't delivered till 30 odd weeks. So why didn't they have more steroids? Because having steroids at 23 weeks certainly weren't going to do any good when you're now 10 weeks down the line. So that's another medical negligence. Um, why did they reverse those babies? So baby A, which you would think was the firstborn twin, was not the firstborn twin. It was actually the second twin. And Steve Brearey switched them. Why did he switch them? Dr. Saladi says things like he was at the delivery. He was not at the delivery. He arrived when baby A was 12 minutes old. So there's a lot of things that just do not make sense. Baby C, we know that mother had been under the fetal medicine unit from 18 weeks because her placenta was not working. And Jim McCormack at Thirlwall clearly states that he was not surprised that tragically baby C had passed away because that baby had been so sick in the uterus. And then, of course, it goes back to nobody asked for the maternity notes.
Mm.
And every single one of these babies was high risk with clearly things going wrong, and the maternity note should have been looked at. But again, out of Thirlwall, a document has come out where it's Dowie Evans writing to the police saying, I don't think we need the maternity notes.
Yeah,
Well, he is so wrong there. I mean, he's wrong on many things, but he should have absolutely asked for the maternity notes.
yeah. I mean, it's extraordinary that the police have allowed this to happen. It's very obvious that they shouldn't have listened to him, but obviously they couldn't work that out for themselves. I think an important thing to add about the early cases about child A, B, C, and D is that these were used in the court case. Once they'd established, oh look, we've now established that Lucy Letby did something here, and then a lot of the other cases are a lot weaker, and then they'll just say, oh, we know Lucy was on duty and there's similar symptoms and it's a similar situation. So basically, they
Yeah,
use a lot of inference from A, B, C, and D.
yeah.
Um, so it was critical that these details were properly communicated to the court. I think I've never to come back to the three deaths in a short period of time. Obviously, it's quite right that they were reviewed. I've never come up with a. I don't know if there is a definitive answer as to why they became so fixated on Lucy. It could be numerous things. Lots of people have their opinions in the comments, and I just don't know. I'd love to be able to say for certain, but I just don't know why they're fixated on her so quickly.
No, no, well, nobody does. And, it's it would be good if they actually became honest, though that's not going to happen. If Steve
And
Brearey actually sat down and went, well, I genuinely believed it was Lucy because she was there, but then he didn't consider that she was one of the few full-time nurses, that she was working extra shifts. So some weeks she was working 60 hours. Um, these babies all had problems one way or another, and certainly A, B, and C had antenatal problems. Baby D was clear negligence that mum didn't get antibiotics, and the baby didn't get antibiotics for 4 hours after the birth. Um, was he covering up the maternity failures? Was he covering up the neonatal failures? Was he protecting Jim McCormack? Did Jim McCormack plant the seed? Um, there's just so many unanswered questions. And certainly when they finally went to the police, in fairness to the police were just out of their depths. But they never once thought to themselves, maybe we should question these consultants more, or maybe we should call in other people. I mean, I'm quite sure that if somebody went to the police and said, oh, my husband's missing or my wife's missing, the first thing they do is investigate the spouse.
absolutely. It's
But
basic.
that didn't happen with the doctors.
Yeah. So I think that's, I can't remember what I was going to say now. It's something to do with the unit. Oh yeah, so one possibility, of course, is that even today, Dr. Brearey couldn't tell you why he did it. But I know what I was going to say. I know what I was going to say. So I'm sure you'll agree with this. So for me, a lot of it comes down to the culture of the healthcare service and the culture of the NHS that I've heard about now from so many people. And it seems to me that they were not. Maybe there was, suspicions about is there malfeasance, but it also seems to me they were looking at has someone cocked up. They were immediately trying to blame someone, weren't they? There was like, oh, let's see if there's one of the nurses on duty, and then we can try and find mistakes that they've made, and then we can say it's all her fault or his. It could be a male nurse, of course. That to me was one of the things that I've thought is that this is just kind of emblematic of a blaming culture that everyone tells me about occurs in the NHS all the time. And I feel that maybe at that very early juncture, they weren't so much thinking malfeasance, they were more thinking, is someone on duty all the time and have they made mistakes and can we blame them, basically?
Well, certainly, I mean, those parents we know, the parents of babies A and B, and certainly D, had
Hmm.
involved lawyers.
Hmm.
So they knew that there was potentially litigation coming down the road.
Yeah,
Uh, and the trust was also in huge financial problems. Um,
yeah,
so, yeah, I mean, we'll probably never know. I think it's a real shame that none of the consultants, Gibbs, Ravi, or Brearey, actually have the guts to come out now and say, do you know what? We pointed the finger at Lucy because we truthfully felt something was happening. But now, having read everything, we should have done due diligence and there needs to be a full, proper inquiry, not this travesty that is Thirlwall, because Thirlwall's looking at everything based on Lucy's guilt. But if Lucy's not guilty, which increasingly appears to be the case, that inquiry is not asking the right questions at all.
absolutely. I mean, what I will say is if they haven't got the courage to phone the police, I would doubt they'd have the courage to do that.
No, well, they're not going to. I know they're not. But I also do think, though, it's a lesson that you learn when you look at politicians that when people actually go, I'm really sorry, I messed up here, and I didn't do it maliciously, I did it with good intentions, that the British public is very forgiving and that reforms can come out of good like that. But these people are just digging a bigger and bigger hole for themselves.
Mm.
And that's why we end up in situations with the terrible cases like the post office, like Hillsborough, that God knows how many inquiries the poor Hillsborough parents have had.
Mm.
Um, it's like cover up on cover up and cover up. Let's just be honest. Let's just look at it in a clear and concise way and stop wasting public money trying to blame people and trying to cover up. There's certainly a lot of evidence, which interesting has come out of America, where they have huge litigation problems with medical negligence in America. But they seem to be learning the lessons that doctors and nurses go, I'm really sorry, we messed up. We missed something, we didn't do something, we gave the wrong drug, we didn't do what we're supposed to, whatever it is. The majority of patients' relatives then go, well, thank you for telling me. And they don't want to pursue litigation because they have the answers. But patients pursue litigation when they are being lied to and covered up because they want justice. They want the truth for their relatives.
Mm.
And that's why we've had so many inquiries with Hillsborough. Those parents rightly want justice for their loved ones.
Yeah,
Same with the post office, same with the blood scandal. The list just goes on, and we don't learn the lesson.
I agree. I mean, I've been talking about this recently. It, if, as you write, if someone, sometime, I mean, I used to do this job, um, and I'll try not to give too many details, but I'd be speaking to people on the phone, and they would be, annoyed with the organisation, rightly so, and I would just say to them, "Look, sorry, I can't defend what's happened. It's totally wrong. It's not my fault, but I'm on the other end of the phone, so I'm here to speak to you, and I'm sorry that we've made a mess of this, and I'm sorry about the situation." And that's all they wanted to hear. Quite often they would just say, "Oh, well, thank you for saying that," and then that's all people want is some contrition and some accountability. And it is, as you rightly say, that the lack of personal accountability and institutional accountability is appalling. Appalling.
And because there's no accountability, the same mistakes keep happening
Mm.
because people do not learn. I mean, that's why they introduced Datexes.
Mm.
Datexes are supposed to pick up when things are going wrong so that you can look at that and go, okay, well, it's obvious why that drug was given late. We're short staffed, or we didn't have enough registered nurses, or they didn't have the drug, or whatever, and learn that from that lesson so it doesn't happen to somebody else. But instead of that, the datexes have now become a weapon where a lot of people don't like datexes. They think they just increase the workload. They want them shelving. We know that Lucy was writing a lot of datexes. Um, and Steve Brearey was supposedly looking at them. So was he getting upset because she was writing a lot of datexes and he felt that he was under pressure because he was the clinical lead of the unit? I don't know, but datexes are actually a good thing. But they're not a good thing if they're just filed, not looked at, and the problems continue. They should be a learning curve.
Yeah. So we've got several questions about data exits. So the first one is if there are any issues arising from a Datex report, the examples given here, a consultant disagreed with the nurse's entry. How are these resolved?
Right, so I was always involved with the Datex reporting. So somebody writes the Datex report and it goes to clinical governance. And about once a month, whether it's every 6 weeks, clinical governance will um, correlate all the datexes for that particular clinical area, and we would have a meeting. So the meeting I would go to, the manager would go to, the clinical lead, who would be the equivalent of Steve Brearey, um, the clinical governance lead would come, and then other people would come if they were free as a training exercise. So they could be nurses or junior doctors. And the incidents would be discussed on why they happened, how you can prevent it happening, how to correct it. However, and I think I mentioned this in a previous podcast, there were some that were just repeat offences. So one of the ones that used to really annoy me all the time was a drug called netlamycin, which is a very powerful antibiotic. And you give a dose to a baby, and then you have to check for toxic levels because it can cause deafness. And the second dose would be given 18 hourly. And for some reason, there was a complete inability to work out 18 hours. So they were always being given either too early or too late. They'd be given at 12 hours, 8 hours, 24 hours. But this magical 18 hours, people just seem to be unable to get. And certainly one of the babies on the indictment, we know, got netlamycin at the wrong time, probably because it's still going on. So I wanted to change the prescription charts to make it easier to calculate 18 hourly. And I got blocked because I got told, no, these are the prescription charts for the hospital. These are standard. You cannot alter them, Michele. So the problem was never resolved, which is just ridiculous. And certainly when I read that Datix, well, I can't remember which baby it was now, but one of the babies definitely got 2 doses of netlamycin at the wrong time. It's probably the magical 18-hour problem again. So it's not that you don't want to change the policies, but sometimes you get blocked by other areas. And I was blocked by pharmacy who wanted standard prescription charts across the trust, not understanding the problems that these drugs were being calculated incorrectly. And I'm sure that happens in other departments as well. So although you try and resolve these Datix problems, it's just not always possible due to other departments, other issues. And at the time, I never sort of pushed that maybe we should have a Datix meeting with pharmacy. But with hindsight, other departments, when it affects them, should also be involved. Certainly, pharmacy never came to any of our Datix meetings. But with hindsight, they probably should have done.
Yeah, yeah. So our staff trained regarding the use of Datix.
Well, they should be. Yes. I mean, Datexes are widely known about. They've been around a long time. I think they were introduced back in the late 1980s. They've changed in the way they're recorded and filed and who looks at them, but the premise of them has been around for many, many years. And as I say, I mean, the idea is a good idea. It's just, it's a bad idea if they're not reformed when you get repeated offences or something major goes on. It's yeah, I mean, it's probably another area that needs looking at. But I think the computer systems have made, I could talk for hours on how bad the computer systems are because they cause so many issues and things get missed and because you have all these pages on a computer system, they're not in chronological order. So when we used to have handwritten notes on the neonatal unit in Chester, the doctors would write, the nurses would write, the doctors would write, the nurses would write. Now you've got a computer system where you've got nurses' notes over here, you've got medical notes over there, you've got prescription charts here, you've got fluid charts there. I mean, I know from the experts who are looking at these notes, and they've been sent them electronically, they've spent hours going backwards and forwards between things because they're not in chronological order. The computer systems are not fit for purpose on so many levels. I have a friend who's a professor of orthodontics, and she says that when she used to write her notes at the end of the clinic, she'd sit there with a dictaphone and it would take her 3-4 hours to dictate the letters to be sent to the GPs, other specialists, maybe surgeons or whatever for her patients.
Yeah.
Now she comes in on her day off because she has to individually access each patient on the computer. So that means logging in, dictating your letter, checking the notes, logging out, logging back into another patient. It's just time consuming. Whereas when you used to have a good old fashioned pile of notes, you just pick up your dictaphone and go through the notes and dictate them. There is such a lot of time wasting that goes on because of these totally inadequate computer systems. And the computer systems don't talk to the national insurance numbers or the birth registration. Um, we've got Badger within neonatal services, but Badger doesn't necessarily talk to the hospital computer. So you're recording duplicate information because the computer systems don't talk to each other. It's a nightmare, and that is a problem across the country. I've heard of so many terrible things, of prescriptions. If you've got a patient with more than 20 prescriptions, then the first prescription will fall off. And then you're going, oh, that patient hasn't had that drug for 3 days. Why? Oh, because it's fallen off, because the doctor's added on more prescription. It's just ridiculous. And nobody is addressing all these problems because the computer companies may have some nurses and doctors sitting advising them, but they're not necessarily from the speciality who's using the computer system. It's just another waste of money.
Yeah, well, I think that broadly speaking, people, I'd say particularly I mean, you could take a cynical view of this, but let's not take a cynical view. Let's try to take a
I'm
positive.
very cynical,
But
Chris.
my view is cynical, but let's try not to take that view. Um, government, if you let's say government is trying to run things the best of its ability, let's just make that assumption for the sake of argument. Often they're told or they believe, oh, we'll bring in a computer system and that'll make everything better. But they completely underestimate how difficult it is to build something. As you rightly say, the people that do the IT, they don't know anything about the subject matter whatsoever. And then the people that know about the subject matter, they don't know anything about IT whatsoever. So actually marrying the knowledge and the IT skills together into a system that has to in an enormous system like the NHS, it has to, and then it has to do so many different things and so many specific things. And then, of course, the people that build the system, they don't say, well, to be perfectly honest, we're not going to be able to do that. They say, ka-ching, we'll make the system, and then it's a government contract, we'll get paid whatever happens. So I think I'm sure that's the case across many big organizations where they they have particularly government. So again, I would contrast that with the private sector. So if you have, for example, a system in finance, it has to work because if it doesn't work, then big companies lose money or don't make money, and they just won't accept that. So I think with government contracts, there's always a risk that oh, we'll do something, we'll do it to the best of our ability, it'll be halfway decent, we'll spin them some story. The government won't really care anyway because they'll be busy doing something else. Just bringing in these systems is inherently problematic, and it's not surprising to me that it doesn't work. I'd be more surprised if it did work.
No, and it's a problem. I was talking to a police officer a couple of weeks ago from Cheshire Police, and we were talking about the computer system within the hospital and the problem with the medical notes and gaining information. And I said, I bet the police don't have these problems, do they? And he went, oh, no, we do. He said, in Cheshire, the Cheshire police computer will talk to the North Wales police computer and it will talk to the South Wales one, but it won't talk to Lancashire and it won't talk to Greater Manchester. So when they have somebody they actually have to pick up the phone and say, could you look on your system? I mean, it's just nonsense. We live in a digital age, and yet the police are still picking up the phone to Greater Manchester and Lancashire because their computer systems don't talk to them. So you're right. All these huge organizations have very, very similar problems. And, how do you fix it? There's been so much money squandered within the health service. I can't tell you how many different computer systems they've had. And at different times, they've all just been ridiculous. I remember when we first got the computer system in Chester,
Mm.
Poor Jim McCormack was going to have apoplexy because it looked like we had a 99% cesarean section rate. Because any woman who came in who even had one suture was classed as a surgical procedure. So the computer was just recording that, oh, this woman's had a surgical procedure that looked like she'd had a cesarean section, but she might just have had one stitch. It's as you say, it's because the IT companies don't talk to the clinicians, and the clinicians don't understand the IT. It's just a mess.
They don't, they don't, they don't really have time, do they? They don't really have time to go and sit in with a IT team and say, "Oh, we need this or we need that."
Yeah.
So yeah, I mean, I'm not surprised. I would be surprised if it worked adequately. Um,
But I think a lot of problems could be alleviated if we had proper computer systems. I mean, certainly if you had chronological notes, not this nursing notes, physio notes, occupational health, if everything was in chronological order, that would make life so much easier. The same with blood results. The blood results come in from biochemistry or microbiology or hematology or wherever. But again, you have to look on each day's set of notes. They're not like a flow chart of, well, this was Monday's results, this is Tuesday's results, so that you can see trends. You physically have to go in and look for those trends, which is time consuming. And things get missed because of that.
hmm. So I think, I mean, you've reminded me of something that's quite trivial, but it's a good example of how difficult it is to implement something like this. So the company that just makes like the football management game that's very popular, like makes billions of pounds, sells a hell of a lot of copies. Maybe billions is an exaggeration, but it makes a lot of money. They will do like an incremental update every year. So they had to scrap last year's completely because they decided we're going to try and remake the game to make it a lot better. So last year's just didn't come out at all. And then eventually they brought this year's out. They couldn't miss 2 years in a row. And it was a disaster. And it's been absolutely panned. It's like one of the worst ever reviewed games on Steam, which is the PC platform. And that's just a football management game.
Yeah.
But it's so hard to build, and people completely underestimate. They just think, "Oh, computers are the answer to everything." It's so hard to build a joined-up system that will do everything you want it to do. And remember, with a football management game, they're the experts that have been doing it for years and years and years and decades, and they've got a specialized team of people working on it, and they still couldn't deliver what was needed. So imagine what it's like when
Yeah.
there's a lot of IT people sitting around going, "What is a stethoscope?" They haven't got a clue really. So
Yeah, they haven't.
it's so difficult.
Yeah.
So let's move on to something else. So I'm going to read out this whole question for you. Um, so this person has written, might be worth discussing how healthcare professionals can protect themselves better. For example, making contemporaneous notes about incidents, ensuring personal areas are free from anything incriminating, e.g., anything patient sensitive should be disposed of, or avoidance of discussing patients on social media or chat platforms. It's really sad that things have come to this, but there are guidelines on how healthcare professionals should deal with patients in respect to social media and probably others which relate to discussing patients via WhatsApp, for example. I think it would be good to hear from a healthcare professional that works in a regulatory or legal role. So, do you have any thoughts on this question, Michelle?
I think it is really, really complex, is this? So I'm of a generation where we didn't really have mobile phones. And we certainly, I did have a mobile phone from the mid 1980s, but I never had it on duty with me. But from my understanding, a lot of the younger nurses and junior doctors have their phones with them all the time. Um, and they use them when they're on duty. I don't know how you can police them not to. Um, Certainly, we know from Lucy's case, Lucy was very prolific on social media. And between her and her friends, they were talking about babies they'd cared for. I personally, having looked at those messages, don't think there was anything malicious or sinister about it. I think it was an update on, oh, I've had a really bad shift. We had this baby die. We had this happen. Um, it's how you keep in contact with your work colleagues. Yes, maybe you could argue that that shouldn't happen, but I can completely see why it does happen.
Isn't it kind of an important aspect of the job though to share information with people that you work with?
Well, it is, but not necessarily when they're not on duty, though, in the good old days, I suppose I would finish duty and speak to a friend of mine who maybe was going on duty the next day, and I'd say, oh, well, we've had this happen or that happen. But it wasn't recorded in those days because it was a voice call. These days, everything is recorded. It's there in black and white in text messages or WhatsApp messages. Um, and that's what makes it quite dangerous because certainly during the court case, all those sorts of conversations Lucy was having have been downloaded and then weaponized against her. The conversations I was having with colleagues were voice conversations and they've gone. There's no record of them. How to protect healthcare officials, professionals, is very difficult again. Lucy brought home handover notes. The media have misrepresented that on many occasions, saying she had medical notes. She did not have medical notes, she had handover notes. And handover notes are just an aid memoir for that particular shift, for that particular nurse, with that particular patient. No, you're not supposed to bring them home, but I don't know a nurse or a doctor in the country who has at some point hasn't brought them home, if not regularly, especially as these days. It used to be easy when you used to get changed into your uniform, but nurses and doctors now travel in and out in their uniforms and they get changed at home. So it's hardly surprising that they're at home with handover notes.
Can I just ask you, Michelle, did you work for the NHS when they used to wash the uniforms?
Yes,
Hmm.
yes. So when I first started training, you had 3 or 4 dresses, and those would go into the hospital laundry. And when you came on shift, you'd have like a little shelf in the changing room, and you'd pick up your uniform, and then you'd go to the linen cupboard and you'd get a clean pinny. And you could have as many clean pinnies during a shift as you wanted, they weren't rationed. Um, but then, people started to, certainly in areas like special care. I mean, we were one of the first that started to wear scrubs. So then the hospital scrubs became universal. Now you do get individual scrubs, but back in the day they were universal scrubs. Um, but then it became, well, we're closing the changing rooms. We're not having changing rooms. We're not having you get changed here in the hospital to save money. And then you're traveling in and out in your uniform. So after a long 12-hour shift that's gone to nearly 13 hours by the time you've given handover and got in your car and got home, yeah, we all bring home handover notes. I personally have brought home handover notes. I've actually, on one occasion when I was working in Liverpool, got home to Chester and discovered that I'd got the drug cupboard keys in my pocket and had to go all the way back and hand them back in. It happens. It's just a fact of life when that's just the way it is. Again, I don't think Lucy did anything malicious. You are supposed to destroy them. She stuffed hers in a carrier bag and put it under her bed. She shouldn't have done that. She should have shredded them, but she didn't. And I bet she's not the first person in the country to do that, not the first nurse. I
No.
know doctors who actually have brought home medical notes, um, which you're definitely not supposed to do, but I know doctors who've done that.
Hmm. Yeah, I mean, I've mentioned before when I had a job, I wasn't dealing with as sensitive information as in a healthcare environment, but it would be personal information, and sometimes you would take it home in your pocket. Um, and sometimes I would take it back into the office and put it in this, sensitive waste or whatever it was called. And so I think sometimes I probably just threw it in the bin because I just used to think, well, no one's ever going to see this. It's buried with loads of eggshells and fish finger packets and stuff, and it's going to go in the communal waste section of and no one's ever going to see it again.
Yeah.
And in a way, Lucy keeping it under her bed was conscientious because she was thinking, well, I can't just throw this away. I'll just store it here. No one's ever going to see it. And you know, she could have. She probably thought, well, I don't want to take in a massive bundle of this stuff to work because firstly, I'll fill up the bin, and secondly, it'll look a bit strange. It's a shame, although they probably would have charged her anyway, seemingly. But it's a shame that they were able to use that against her. And it's a shame that she just didn't think, oh, well, I'll take that in tomorrow, rather than putting in a carrier bag. It's a shame or it's a shame she didn't think, right, well, I'll shred this now and I'll shred all my notes now and stuff, which she could have done, of course.
Well, she could have done. She could have very easily done that. And, maybe she forgot she had a shredder because certainly Nick Johnson made a big thing about, do you have a shredder? No, you don't. Well, you're lying. I mean, for God's sake, it's just another nonsense, isn't it? It's just another thing to make her appear guilty and malicious and devious and any other word you want to put to her. Um, I mean, certainly if the police raided my house, they'd find documents going back to the 90s. I've still got the Department of Health white paper from 2003. I've got tons of correspondence. I've
Mm.
got emails and all sorts. Maybe I should have destroyed them. Maybe I will get a knock at the door now from Cheshire Police. I don't know. I hope not. But I don't think there's a health professional in the country who at some point hasn't brought home documentation. Whether they've done it deliberately or innocently is, another question. But I don't think it's if they have brought it home deliberately, I don't think it's for malicious reasons. I
Mm.
think maybe they've just thought, oh, that's an interesting document. I might do some further education and need to reference that or whatever.
Mm.
It's, certainly in my day that used to happen, and that's probably why I've kept the Department of Health white paper from 2003, because thinking, oh, I'm going to do an essay on it or an article or whatever.
Yeah, yeah, absolutely. So another question relates to feedback. So this person wants to know, how would you tamper with the feedback? I can't find any reference to how this was done. How
Sorry,
to,
I can't hear my dog's barking. Sorry, say that again.
we used to get dog interruption, and it's usually like, that's fine. Um, yeah, how would you tamper with the feedback? This person can't find any reference to how this was done. Has there been any work or research done on this, or is it just entirely hypothetical?
I don't know if there's been any work done on it because tampering with a feedback is a malicious act.
Hmm.
But all I can comment on is that we do at different times take fluid out of feedbacks and put additives in. And when a bag, say if you take a bag of dextrose, a litre bag, it comes with a plastic cover, which you have to tear to take the bag out. And then there's various ports, one to put the admin line in, one that is like a stopcock that you can eject things in or you can withdraw fluid out of. Um, I think what's more interesting is that Lucy was supposedly injecting all this insulin. And as I said before, where did she stockpile all these ampules?
Hmm.
Nobody saw her take the ampules out of the fridge. Pharmacy never reported that the ampules were missing. Nobody, for the amount of ampules that you'd have had to inject, according to Helen Shannon, she'd have been there for ages, drawing up, injecting. It's just a nonsense. And nobody in a busy intensive care unit saw her do anything. Nobody saw her do anything at all. Now, I think if somebody really has intent, they would disappear maybe into a bathroom or something to do that. But then they've still got to take the syringes and the needles and the ampules, and then they've got to come out and dispose of all of those. And if you're trying to dispose of 20 ampules that you've emptied and injected, I mean, where are they going to? Somebody's going to see you.
Hmm.
It's, I just don't think it's feasible at all, if I'm honest. I really don't.
And another aspect of this, of course, is that Lucy at this point has supposedly already successfully murdered infants with air, right?
Yeah,
This is child F, so it's the sixth infant in the case. So she's thought, oh, I know, I'll have a go with insulin. I mean, insulin could potentially leave a trail, obviously,
yeah,
but I'll have a go with insulin anyway. And then that wasn't successful. So then she said, oh, I'll go back to air again now for a bit. And
yeah,
then came to child L, oh, well, I'll have nothing to go with insulin. Oh, it's
yeah,
fine again. I'll go back to air again now.
yeah. And in between, I might inject them with milk, and then by the time we get to baby O, she's whacking them in the liver.
It's a
I mean,
joke.
it's
It's an
I have
absolute joke.
I've never heard of a serial killer changing their methods so frequently and chopping and chopping. I mean, serial killers tend to be quite fixed in how they murder their victims, but this is, and that goes back to Dowie Evans. I cannot believe that Steve Brearey and Ravi did not, when they started to hear what he was coming up with, go, no, this is nonsense. So then I have to ask myself, what was going on in their heads that they were so malicious that they couldn't go back to the police and say, I know you've got this expert, but in actual fact, this doesn't make sense. This doesn't make sense. They must be, I don't know how they sleep at night, if I'm honest, when I go down that rabbit hole, because I know that I was phoning Cheshire Police in 2018 and I was only phoning them on very limited knowledge,
Hmm.
whereas they would have had a great deal of knowledge because they were right in the middle of the case. And yet they never went to Cheshire Police and said, actually, this something not right here.
Hmm.
Those are not nice people if they recognize that Dowie was coming up with, excuse my language, BS, and yet they still ran with it.
Yeah. I mean, the most generous thing we could possibly say would be perhaps they were so invested in the position they couldn't see it. That's the otherwise they don't have a conscience.
No, they don't have a conscience. Yeah.
Those are the two options, really.
Mm.
And I'll leave
And
other things.
even now, it goes back to our conversation earlier on. They can't have a conscience because they must be reading everything that is coming out about this case. So you would think if they had any sort of moral compass, they would be phoning up maybe Lucy's barrister and saying, we really messed up here. We're so sorry. We don't know whether Lucy did do it or didn't do it, and you need another trial, but we have serious concerns. But they're not doing any of that to protect themselves, aren't they?
Well, I don't know if you read the interview he did, Brearey. It was with some European newspaper.
Oh, yes, yes, yes. I spoke to her at length. Yeah,
Okay.
it was very interesting.
So that to me, I don't know if you remember the article, but there was a point where he was saying, "What else could we do?" We thought were problem. It was almost like he was preparing his defense.
Yeah, yeah.
That was the first time I'd seen. I wouldn't go as far as to say contrition, but I would say like a little setback, you know.
Yeah.
So maybe they are think. I mean, as you say, it would be extraordinary if they hadn't, kept up with this, and I'm sure they must have done, surely.
Oh,
Uh,
well, they must be reading everything. They must know what's going on. Um, they, I don't know. I mean, now, I mean, why would they perjure themselves? Why would Ravi perjure himself? And we know that he has perjured himself. You would think that even if it was just off the back of trying to save his own skin, he would be now saying, okay, I've really messed up here. I forgot that Lucy did call me. I've lied in court, and therefore I should hold my hands up and say, I'm really sorry. My memory played tricks on me, and we need to relook at that. But instead of that, like all the inquiries we talked about before, he's just digging himself a bigger hole. He's just digging himself a really big hole.
yeah. I think it's the same with Dr. Evans. I mean, Dr. Evans could come out now and say, or even before now, he could have said, well, I tried my hardest at the time. I accept that I may have made mistakes, words to this effect, and he could withdraw his evidence.
Well, I think Dr. Evans, though, is a different kettle of fish because he was employed by the prosecution.
Hmm.
He's on record of saying he's never lost a case. So he's obviously very biased. He would argue he was giving his professional opinion.
Hmm.
And I think his testimony goes to the problems with the judiciary rather than trying to scapegoat somebody or protect their own, which is what Steve Brearey and Ravi were doing. So there's two really different issues there. And I think we have to look at how the judiciary operate. It is completely stacked in favour of the prosecution. And even though these so-called experts have a duty to the court, they are not employed by the court. They're recruited by one side or the other. And the majority of these experts are recruited by the prosecution. It's very hard for defence to get experts because they don't have the same playing field. They don't have the same money to pay. I've been told that a prosecution expert will get paid £280 an hour, whereas a defence expert will get paid £150 an hour. Now, if you're earning a living, who are you going to go to?
Yeah.
And I hope that there's some expert witnesses out there who have a moral compass, and despite whichever side they're employed by, they give a true expert opinion. But I don't think Dowie Evans is one of those characters.
Hmm.
I think he gave his opinion, and I mean, he's on record of saying, I've got my daughter's horse to fund, I've got my son's cars to run. He was on the gravy train. And how many people, how many politicians have we seen on gravy trains? How many other inquiries have we seen on gravy trains? I can't actually call out Dowie Evans for doing what he did because he'd just argue, well, I was given a professional opinion and that was my professional opinion. Steve Brearey and Ravi are two very different characters, though,
Hmm.
because they are, and they're still working. How can you have two consultant pediatricians still working clinically and yet believing that rubbish
Hmm. Yeah,
and,
absolutely.
and committing perjury and just not having a moral compass to think we have locked up a young nurse for the rest of her life? I mean, I just don't know how they sleep at night. I really don't. I have no idea how they sleep at night.
Yeah, I agree. Okay, so that's great. So I'm going to ask Michelle a technical question now. So I have to confess that this question meant absolutely nothing to me, but Michelle understands it, so she can explain. So this the question is simply about Dewi Evans setting up the adult giving set and comparing it to what actually happens in a neonatal unit. So I didn't know what that was referencing, but I probably should have done. But M Michelle will answer this question and explain.
Okay, so a giving set is a line that you inject into whatever chosen bag of fluid you're giving, whether it's dextrose, saline, TPN, whatever, and then it's attached to the patient so that the fluid runs down and goes into the patient. However, an adult giving set, by just the fact it's an adult, is the line is a wider bore because obviously adults have bigger veins and arteries, so you can run fluids in quicker and you can get more volume in. In a neonate, you don't want to run fluids in relatively quickly or overload them with fluid. So you have a pediatric giving set, which is a much smaller bore. It goes in more slowly. I mean, God love Dowie with his Daniel Bugado documentary, and he was so proud, wasn't he? And he had his red wine and he injected it, but there's so many things wrong with that. First of all, he had the wrong giving set. He had an adult one. there was no resistance because it wasn't attached to a patient. Um, it was just, and he sort of snuck it into his pocket and then smirked as if to say, aha, that's how she did it.
It's
I
obviously
mean, it's just such nonsense, honestly.
obviously liquid as well.
Yeah, yeah, it's just,
Not air, of course.
yeah, not liquids. It's just nonsense. And also, when you give in intravenous drugs, say through a giving set with a baby, you've got three-way taps, you've got rubber bungs. Um, all fluids given to a neonate are run through pumps of various description, be a syringe pump, um, a giving set pump. They have pressure lines on it so that you know whether it's working accurately. I mean, that's one of the problems with some of these babies that who didn't get fluids despite the fact they were supposedly getting them. I mean, there was one baby where the pressure line was reading nearly 200. Well, that's way too high for a baby. And it was clearly demonstrated because when the doctors came in the morning, uh, the whole of the leg was swollen. So the nurse should have recognized that that pressure was totally incorrect for that baby. But for whatever reason, they didn't. And they just kept saying, yeah. I mean, at one point, I think they put, oh, it's a positional line, but it was clearly tissue in. So the fluid, instead of going into the vein, was going into the soft tissues. So yes, Dowie's giving set demonstration is worthy of Blackadder. I mean, it's just a comedy show. It really is, and it means nothing, and it's not relevant. And I'm sure it made him feel very much better that his testimony, he could clearly demonstrate it, but it's not accurate in any shape or form.
Yes, absolutely. So I've got a question for you about Lucy's defence. So, have you had any involvement with Lucy's barrister, Mark McDonald, and would you consider being part of any new defence team, given that you are not working at the hospital, which could have hindered you from supporting the defence?
Yes, I know Mark McDonald very well. I've had long conversations with Mark. Um, I'm not an instructed witness, but I have had conversations with Mark where he says that if it gets to a new trial, he may call me because of my nursing experience, um, and because I knew the unit, but we're a long way off that.
Yeah.
But yes, I do know Mark, and yeah, I think he's doing a good job. He had to go public because he's received a lot of criticism about calling out what Dowie Evans said and putting things in the public arena. But I don't think he had any choice because this is such a high profile case. And unless you change the public perception, the CCRC would never kick it back to the Court of Appeal for at least 20 years. I mean, we know so many people who have reapplied and reapplied and applied and reapplied to the CCRC, and it has taken them 20 years. And that's because probably there wasn't public pressure.
Mm.
So you can criticize Mark for what he's done, but I don't think he had any choice. And I think he's actually done quite a good job.
Yeah, I mean, we could go on all day about the previous examples, but all I would say is Peter Sullivan came out of prison recently, having been wrongly convicted, and he was in prison for 38 years. We didn't hear about that until he was released. So his barrister and his legal team or whatever, they weren't criticised. But what do you think the client would prefer? Do you think the client would prefer the barrister not to be criticised, or do you think the client would prefer to come out of prison, 25 years earlier? I mean, it's a no-brainer. Of course, he's got to do whatever he can to raise awareness. It's absolutely essential.
Well, I
Um,
think we have to look at the judiciary. I've had my eyes so wide open with this case now, and I think I've always believed in the British justice system. I believe that we had a good system. I believe in trial by 12 good men. I don't know if I do believe in any of that anymore because I've seen so many problems and I've met so many people who have tragically been miscarriages of justice. Tom Hayes being one, Michael O'Brien being another, and their stories are harrowing. And it's like Sir David Davis says, the judiciary is sometimes more interested in following due process than looking at what is factual, what is accurate. This ridiculous thing with the Court of Appeal, you can't have a second bite of a cherry. Well, that's just nonsense because that's not actually justice. And certainly, I mean, Andrew Malkinson had DNA. It was unequivocal. He did not do it, and yet it still took them 20 odd years.
He lost three appeals.
I know he lost three appeals, and the parole board gave him an extra 5 years because they said he was in denial.
Yeah. Yeah, well, he could have come out of prison after 6 years, I believe,
Yeah,
but he just wouldn't say he was guilty,
because he wasn't.
which is a reasonable position. But I don't know what happens in terms of if you say you're guilty, can you then later be exonerated? I have to say, if it was me, I would have said I was guilty because I would have just thought, well, okay, I'll be on the sex offenders register, but at least I'll come out of prison. I mean, in prison as a rapist is no picnic. In a way, it's incredibly courageous to say that you're innocent in those circumstances and to serve. Maybe you didn't think he served another 11 years, but you have to be really brave to do that. I think. But yeah, it says everything.
It goes back to the process is all wrong. The process is all wrong. I mean, we currently have a government that is releasing real criminals, including rapists and domestic abuse perpetrators, uh, because they say the prisons are too full. But we know that there are innocent people in jail. I recently went to Parliament to listen to a debate on miscarriages of justice.
Hmm.
And my jaw was on the floor because one of the statistics they put out was that they currently calculate between 2 and 10% of all convictions are innocent people. Now, if you have a population of 100,000 in prison, that equates to between 2 and 10,000 people in prison for a crime they have not committed.
Hmm.
And I find that really frightening. And what is more frightening is okay, they've been convicted, but then it's literally like, oh, we're going to throw away the key because the way of appealing is so unfair in this country and it's as slow as a glacier.
Hmm.
I mean, you have, for all the faults in the American system, you actually have a better chance of being exonerated in America because they have more routes to appeal than we do. It's like, no, I mean, nobody ever gets to the Supreme Court.
No.
The Supreme Court, and if you take Colin Norris, who's Colin Campbell, the
Hmm.
nurse who's in jail for supposedly being a serial killer, again with insulin.
Hmm.
So he recently got to the Court of Appeal, and I went to listen.
Hmm.
They rolled out the same experts who are now in their 80s and 90s that first convicted him. And there was three judges there, and the three judges upheld his conviction. So he's back in prison. Well, he was never out of prison, but he's in prison for God knows how long now. So he appealed to the Supreme Court. And what really drives me mad, the same three judges who have thrown out his Court of Appeal, saying, no, we think your verdicts stand, have now rejected his application to the Supreme Court. It should be three completely independent judges looking at the evidence that was presented by his barrister, Mike Mansfield. But of course, they won't do that because, a bit like in the medical profession, it's very hard to get a consultant to call out another consultant. It is beginning to change, but it's a long, hard slog, and that's why whistleblowers get treated so appallingly within the NHS. It's virtually impossible to get a judge to call out another judge. But judges need to be held accountable. And certainly, some of the stories I've heard, particularly with the family courts, judges have made some appalling decisions, and yet they're never held accountable. Never ever held accountable. And that has to change. That's another area that has to be looked at.
Yeah, I mean, I was very much the same as you, Michelle, and that I was naive about the court system, but I did know the family courts produced some very dubious verdicts, shall we say. So, given that our friend Dewi has been a major part of that system, that doesn't inspire a lot of confidence, does it?
I feel sick when I think about the damage that Dowie might have done in the family courts. And I'm amazed that Judge Goss, who received a letter from
Hmm.
Judge Jackson, didn't take it seriously and said, "Oh, we'll let the jury
I mean,
decide."
how can they?
How
How
on
can
earth
it's
can the
absolutely
jury
ridiculous.
decide on what or who is an expert witness? When you've got one judge, and it's a very rare event that a judge will write to another judge calling out an expert, alarm bells should have been ringing left, right, and centre, but they weren't.
Hmm. Another thing to note, actually, Michelle, is that in his summing up, um, Judge Goss hasn't even realised that Dr. Evans isn't a neonatologist, and Ben Myers has to kind of like force him to say he's a pediatrician.
Yeah,
He thinks he's been there for 10 months, but he still thinks that Dr. Evans is a neonatologist.
I know, I know. And he thinks he's a neonatologist, but you're right, he was never a neonatologist, but he hadn't worked for God, nearly 15 years. I mean, I have a working knowledge, but I would never put myself up as an expert because I haven't worked since 2007 clinically.
Hmm.
And I know, how fast medicine changes. In court, Dowie Evans was given an oxygen saturation monitor and he didn't know what it was. Well, even I know that's basic kit,
Hmm.
but he didn't know what it was.
I mean, it seems to me that should be one of the immediate things that are enacted when this is over. Um, there should be, if you're going to be an expert, I'm not saying that on the day you retire, you can't be an expert immediately, but there should be a cut-off point of a few years.
Mm.
He shouldn't be able to be, he's 15 years by the time he's in the court case.
Yeah, yeah.
I mean, come on, it's
But
just,
I think all these really complex court cases now, like Lucy's, like Tom Hayes with the libel rate. I mean, if I'd been on that jury with the libel rate, I don't understand how banking works. I don't understand the interest rates. I would have been completely out of my depth. And there's tons of cases like similar, whether it's computers, I can just about send an email. I wouldn't understand an IT fraud case. And the judiciary have not kept up with all these complex medical cases, bank rate fixing, IT, whatever. And therefore, I think it needs to go to something along the lines that if you're tragically diagnosed with a malignancy, it goes to what's called an MDT, which is a multidisciplinary team. And I think the judiciary need to look at something like that before it even gets to court. That you don't have prosecution and defense, you have experts who look at everything and debate whether they do think there is criminal activity here or whether there is suboptimal care or whatever.
mm,
But and it would save a lot of money. I mean, Lucy's trial has cost millions of pounds, taxpayers' money, and now we're into an inquiry that's going to be another waste of money with Lady Justice Thirlwall. And, then we've got appeals coming, I hope. And who knows, we might have another trial.
mm. I mean, I think that if you add up everything, it's probably 100 million.
I wouldn't be surprised.
It'll be at least 50 million. That'd be like a really low ball estimate, but I think it would run to 100 possibly. if you think about everything and all the expenses. Even Thirlwall was just 13 million,
Yeah.
and that was at the end of the last financial year. So
Yeah.
it's going to be an extraordinary amount of money, as you say, that's just basically completely wasted.
Yeah.
And worse than wasted, um, used to create a horrible situation that is basically a national embarrassment. So yeah, it's very regrettable.
But
Uh,
it just goes back to what we've said before. We don't seem able to learn the lessons. How many Hillsborough inquiries have we had? And how many times are the poor blood victims going to be called out? And the post office, and the list just goes on and on. And it's really scary.
it is, it is. So let me ask you a question about the NHS. Does the NHS have a way for specialists and units to share best practice and learn from each other in dealing with incidents or cases that occur on the units?
Well, the NHS, certainly within different departments, should learn best practice from other clinicians and other departments by nurses and doctors being kept up to date, attending conferences, learning about new drugs, new procedures, new whatever. Whether that is formalized within the NHS, I don't think actually does happen. I mean, there are departments within the NHS that will put out documents saying you mustn't use this drug anymore or you mustn't do this procedure anymore. But how that's policed, I don't know, because you're always going to probably get a rogue doctor. I mean, if we take the whoosh test, for example, the whoosh test was commonplace in my day and had gone on for tens of years. It was outlawed in about 2010 because it was deemed that in the wrong hands people could make mistakes. And I think there was a couple of incidents. So they said, right, you can't inject air down a nasogastric tube anymore because of the risk of putting the tube in the wrong place and it actually being in the lungs and not in the stomach. However, I've spoken to people who say, well, actually, sometimes I still do it. And they're very experienced people who've been doing it for 40 odd years.
But
I
what,
would
what
actually
is
trust them to do it, but nobody's policing it. And they're not supposed to be doing it, but people do.
and what is the purpose of, just to outline, what is the purpose of the whoosh test?
Oh, well, the whoosh test was when you put a nasogastric tube down, it's very easy to put it down the trachea as opposed to the esophagus. So you're supposed to draw back stomach contents and test for acid because there's no acid in the lungs, there's only acid in the stomach. So if you know that you've got acid coming back up, you know it's in the stomach. And then you can do whatever you need to do with that tube. You can put milk down it or drugs or whatever. The last thing you want to do is to have a tube in the trachea and put milk or drugs down it because then you're effectively drowning your patient. So that's what it was designed for. But on occasions, you cannot get gastric aspirates out, certainly on a newborn baby. The stomach might be empty. So, what you would do is you would inject air down while simultaneously listening with a stethoscope over the stomach area to hear air gurgling in the stomach, and then you would know it was in the stomach. But it was deemed that in the wrong hands, people misheard, and therefore it was in the trachea. I don't know how many incidents there was, but it was just deemed not best practice. But I have heard people still using it. And in fact, I was talking to a pediatric surgeon not long ago who said, oh, we still use it in endoscopy all the time. We inject air down it. I mean, they're obviously very capable and know what they're doing. It's like any of these things. These things are only dangerous in the hands of inexperienced people who don't know what they're doing.
Hmm.
And that's true of any procedure. Um, be whatever. I mean, in midwifery, forceps can be a very dangerous weapon, but in the right hands, They save lives.
I mean, a lot of these things you mentioned, I don't fancy my chances. To
No,
be honest.
but in the right hands, they save lives and are good. But in the wrong hands, they are a very dangerous weapon.
Yeah. So speaking of procedures, I've got a question about intubation. So just simply, why were the doctors and consultants at the Countess Chester? And I think some of these procedures, to embellish this question, were entrusted to registrars. But why were they so bad at performing intubations and managing PICC lines and umbilical catheters?
Well, I think it's just very simple. They just weren't there doing them often enough. It's like anything. The more you do it, the better you get at it. And they just weren't there and they weren't interested. And certainly in my day, we had excellent registrars. I mean, the whole system has changed. The training has changed. So you have to look at that on the medical staff. We had A&MP. So, I was quite slick at intubating. Um, but if you've got somebody who only does 3 intubations a year, they're not going to be as slick as somebody who's doing 3 a week. And that's just a simple fact. Um, I think they were just out of their depths and they were overconfident. Overconfidence within a healthcare setting is very dangerous because when you're overconfident and over arrogant, that's when things go wrong because you don't ask for help or you don't recognize that things have gone wrong. I mean, that certainly is what happened with baby Noah Robinson. They made a genuine mistake and they intubated that baby's esophagus as opposed to the trachea. But the real crime was that they didn't recognize that and they didn't believe the monitors. They spent 40 minutes messing about, changing monitors, changing probes, rather than using their clinical skills and going, this baby's chest is not rising and falling, this baby's colour is not coming pink. Oh, the saturation monitor says that his oxygen level is 40, it should be 90, the carbon dioxide monitor is through the roof. They just didn't join up the dots. They didn't use their clinical skills and look at the whole picture. And that's why, tragically, baby Noah Robinson died.
And why were they so fixated with the monitors exactly?
I don't know. I don't know. I think again it was over arrogance. They didn't even consider that they had done anything wrong. And things happen, I'm not I'm not criticizing people making mistakes. That happens in the medical setting. The mistake was when you don't recognize that you've made a mistake. And instead of looking at your own practice, you try and blame it on a piece of machinery or something else. And that's what they did with Noah Robinson.
Mm.
That consultant did not look and think, actually, maybe this tube's in the wrong place. Let's remove it. I mean, she did eventually, but then she made the same mistake again. I mean, the coroner said there was 5 opportunities and they didn't take any of those 5 opportunities.
Right, so that was an unscheduled interruption to this interview. So please continue from where you were before.
Yeah, so people make mistakes and things go wrong. The big mistake is though when people don't recognize that things have gone wrong and then try and hide the mistake
Yes.
instead of holding their hands up and going, really sorry, we made a mistake here. We need to fix it. And being honest about it. I don't think there's any shame in admitting that you've done anything wrong. The shame comes when you drive it underground because then it just exacerbates it.
Yeah, absolutely. It's a kind of a theme running through the whole thing, isn't it? Just lack of accountability, personal responsibility.
Yeah.
Um, so I'll ask you one last question for today, 'cause I think we've got the best part of 2 hours. How bad, another procedure question, how bad was the staff understanding of ventilation pressures, in your opinion?
Well, Clearly, from babies O and P, they did not have lung disease and they were put on far too high pressures. Um, I've been told that the pressures they were put on was like 32/6, which is really high for a baby who's not got lung disease. You do on occasions need to use high pressures because babies who are born with severe respiratory distress syndrome, their lungs are really stiff. But high pressures come with their own set of problems, so they should always be used with caution because you can cause as much damage as you're trying to correct. It's like having a pneumatic drill with air being pushed into your lungs. If that's repeatedly happening, it can seriously damage the lungs. So yeah, they shouldn't have put them on such high pressures. But they did so many things wrong with those two babies. I mean, baby O, when he first collapsed, they intubated him, moved him to intensive care, but then disappeared and didn't put any lines into him. They left him with one peripheral cannula. You never have a baby in intensive care with just one peripheral cannula because if they collapse, you literally are then trying to put in more lines, and that's what they were trying to do with baby O. And in the end, they couldn't get any lines in because by the time he had the second collapse, he was completely shut down, and they ended up having to put an intraosseous infusion in. And when they put that, and then you have to look at all the different things. So they had spinal needles. They didn't have intraosseous needles because there's Datix reports that have come out now with Ariane saying, I'm going to order an intraosseous set. When you look at baby P, they put the spinal needle right the way through the thigh. So when actually the baby had passed away, Lucy came to remove it and ended up with a needle stick injury, but they didn't realize during the resuscitation that it wasn't even in the right place. And that's probably because they were using spinal needles as opposed to intraosseous needles. So it goes back to when we started this podcast, Chris. All of these things were never one thing. They were a catalogue of things going wrong. And you've got to look at the bigger picture. Like we only know about the fact they didn't have intraosseous needles because Ariane did Datix reports. You can't just look in isolation at the notes. You've then got to go back and look at the Datexes. You've got to look at the staffing. You've got to look at who was on duty, the caliber of the staff on duty. It's a whole picture that you need to build up, and nobody built those pictures up.
Yeah, I think when you read the preview reports from the panel, you see it's not, oh, this infant just died because of this one thing. It is, you see the full picture of all the things that were wrong, all of the initial serious conditions and illnesses that the infants had, and you get a full medical picture, which is obviously what we didn't get in the court case and what we didn't get from Dr. Evans.
Well, no, because he portrayed all these babies as if they were perfectly well,
Yeah.
and they were all about to go out and have a tea party, and there was nothing wrong with them. Absolute nonsense. These babies were sick babies,
Yeah.
and that's not the way the jury were told about these babies. They were not portrayed as sick babies. They were not told they were sick babies. They were not told about all the maternity problems that had gone on antenatally before these babies were even born.
Yeah, absolutely. In fact, we know for a fact now that they didn't look at those notes. It was pretty obvious anyway, because it doesn't feature in the court case, but we know for a fact that that is the case now. So
Yeah, they didn't even get the maternity notes, and Mark's having a really hard time trying to get them. He's now instructed Professor Jim Thornton, consultant obstetrician, to try and have a look at the baby's notes to work out what was going on. Um, and I believe he's asked the CCRC. The CCRC do have the power to go back and say, right, we want the maternity notes. I sincerely hope the CCRC do that,
Yeah,
but only
hopefully.
time will tell.
Yeah, it's an essential part of the picture. I think that's very, very clear. Anyway, thank you, Michelle. I can say that we've got absolutely nowhere near the end of this list of questions. So we'll definitely have you back soon. We'll let you have Christmas off first, or maybe have you in January. Thank you very much for joining us again today and sharing all your expertise and knowledge. It's
Thank you for having me.
very much appreciated, but I'll speak to you again soon.
Okay, thank you. Take care. Have a lovely Christmas.
Thank
And
you.
to all your viewers as well.
Yeah, and you too. You too.